Do I have consent to perform and record this assessment?
Yes.
Okay. Knock, knock, knock. Hand hygiene. Hi, my name is Emily. I'll be your nurse today. I'm here to perform a head-to-toe assessment. Can you give me your first name, last name, and date of birth?
Bruce Atlas, 2003, February 3rd.
And do you have any allergies?
Yes, sulfa.
And what happens whenever you get these allergies?
Itching and rash.
Okay, I'm gonna ask you a few more questions for the assessment. What brings you in today?
Chest pain.
You're having chest pain? And when did this start?
When I was doing activity in the field.
Okay. And what kind of chest pain? Does it feel aching, burning, a sharp pain?
It's just dull, and I also get shortness of breath.
So you're getting shortness of breath during the activity?
Yes,
And is it radiating or is it just staying in one spot?
one spot.
Okay. And so you believe that the pain is coming from activity and shortness
Yes.
of breath?
Yes.
Okay. And on a scale of 0 to 10, 0 being no pain at all and 10 being the worst pain you've ever felt, what would you rate your pain?
8.
An 8 out of 10? Okay. And are you having any other issues other than the chest pain?
No.
Do you have any past medical history I need to know about?
No.
Do you have any family medical history?
No.
Okay. And are you currently on any medications, prescriptions, supplements, or over-the-counter medications?
No.
Okay. And are you up to date on your immunizations?
Yes.
So you've had your influenza vaccine, and what I wouldn't ask about pneumococcal because you're not over the age of 85, and you've tetanus.
Yes.
Okay. I'm gonna ask you a few more questions. Do you know where you are?
Hospital.
Okay. And do you know what year it is?
2021.
Okay. The patient is awake, alert, oriented, and ×3. Her speech is well articulated and clear. She's sitting in a erect position. She seems well nourished for her age and weight. She is dressed appropriately for the weather. She's well groomed, well nourished, sitting erect. She doesn't seem to be in any distress at the moment, correct? Okay. Now I'm going to start my assessment. Can you mind pulling your mask down? Okay, now looking at her and her head, palpating the head. Hair distribution is evenly distributed. I don't see any lesions. Normal cephalic head. Her eyebrow distribution on her hair, on her eyebrows is good. Her conjunctiva are clear and her sclera are white. I'm gonna go ahead and check her pupils. And then can you look at my pen? Now look across my shoulder. And pupils are equal, round, reactive to light and accommodation. Nose is midline. Her mouth seems moist and pink. Open your mouth and say ah. And now move your tongue left to right. Uvula rises to the midline. Tongue is in the midline. I don't see any lesions. Buccal mucosa is pink, smooth, and even. You can close your mouth. Okay. I think I got everything for that. Now I'm gonna look at your ears. Looking at the ears, the external ear, there's no signs of lesion or unusual discharge. I'm gonna go ahead and inspect her tympanic membrane. Looking at it, the tympanic membrane is pearly gray and translucent, and the cone of light is reflective. And that is on both sides bilaterally. And are you having any ear pain?
No.
And now looking at the neck is, the trachea is midline. Her skin tone overall is equal, evenly distributed, and you're not in any pain right now? Okay.
8/10.
Okay. Now I'm gonna move to the back to palpate the thyroid gland. Now I'm gonna ask you to swallow, please. Not swallow again. Thyroid gland is, there's no abnormalities and it's not palpable. Now I'm gonna start my posterior examination. Again, looking at the contour of the back, everything is equal. She's sitting up erect. Skin color is even. Now I'm gonna test chest wall expansion by placing my thumbs at T9 and T10. Now I'm gonna ask you to take a deep breath. Chest wall expansion is equal and symmetric bilaterally. Now I'm gonna go ahead and auscultate the 18 spots posteriorly, the lung sounds, but I'm not going to do 18, I'll do 12 for this assessment. And I'll be listening for normal breath sounds as well. Whenever I place my stethoscope, can you take a deep breath in and out?
I did not notice any abnormalities, any passes or anything. So next I'm gonna go ahead and go on to the urinary. Okay, so let's ask, when was the last time you urinated? Okay, do you have any problems urinating? Okay, and what was the pain?
Okay. I heard normal bronchial, vesicular, and vesicular breath sounds. Her lung sounds were clear and equal bilaterally. The patient doesn't seem to be in any distress right now. Now I'm going to move to the front and inspect the anterior chest. Okay, looking at the chest, skin color is evenly distributed. Quality of respirations, there doesn't seem to be any use of accessory muscles at this moment. She doesn't seem to be in any distress right now. Everything is equal. Patient is sitting up erect. Now I'm going to check the skin turgor by pinching the clavicle. And there was no tinting. The patient is well hydrated. I'm going to go ahead and auscultate the 10 spots on the anterior chest. Whenever I place my stethoscope, just take a deep breath in and out.
Look at the upper extremities. I see the colors evenly distributed, no swelling or edema. Feel for it. It appears to be warm. I'm going to go ahead and feel radial pulses. Okay. Close to bilaterally. Can you grip onto my fingers? Okay. Grip strength is equal bilaterally. I'm going to go ahead and feel my capillary reflex.
I'm also going to listen to the neck for the bronchial sounds.
Okay. Less than 2 seconds.
Okay. And upon auscultating, I heard normal bronchial breath sounds, bronchovesicular, and vesicular sounds. Breath sounds, our lung sounds were clear and equal bilaterally.
Skin is warm. Okay, so now I'm going to go ahead and check the posterior tibial.
Okay, now that I'm done with auscultating the lung sounds, I'm going to ask you to lay down so that I can auscultate the heart and start my cardiac assessment. Okay. As she laid down, I don't notice any heaves, lifts, or thrills.
I'm going to go ahead and posterior tibial. Alright, bilaterally.
Okay. Starting with the aortic, pulmonic,
So next I'm going to check capillary.
herbs, tricuspid, and mitral. And I would listen to the apical pulse for 1 minute and compare it to the radial pulse.
Okay, less than 2 seconds. Alright.
And they are equal and regular.
Next, can you go ahead and put your toes towards the ceiling and then towards me? Okay, can you do that again?
I forgot to do something.
Okay, so plantar flexion, dorsiflexion.
I'm gonna go ahead, I don't know if I can do this now, but I'm gonna go ahead and palpate the carotid artery. Both sides separately. It was +2 normal, equal bilaterally. Now,
Setting, make sure side rails are
that I've done my cardiac assessment, I'm going to go ahead and start my upper extremities and lower extremities, musculoskeletal. Are you in any pain? Do you have any muscle weakness right now? And looking at the size of the upper and lower extremities, the muscles seem equal bilaterally. I'm going to go ahead and palpate the upper arm. Okay. The temperature is warm and equal bilaterally. Skin color is even, and there doesn't seem to be any signs of redness, swelling, or edema. Now I'm going to assess the radial pulses, and those were equal +2 bilaterally. Now I'm going to assess capillary refill. And it was normal, less than 3 seconds. During my assessment, I didn't notice any limitations in her range of motion. And I'm also going to ask you to squeeze my fingers to assess your muscle grip strength. Okay? And the grip strength was equal +5 bilaterally. Now I'm going to move to her lower extremities. As she stated, she was not in any pain. Muscle sizes look equal bilaterally. Skin color is evenly pigmented, equal. Temperature is warm, equal bilaterally. Now I'm going to assess her posterior tibialis pulses. Those were +2 equal bilaterally. Her dorsalis pedis pulses, +2 equal bilaterally. I'm going to assess capillary refill. And that was less than 3 seconds. Now I'm going to test plantar flexion and dorsiflexion. I'm going to ask you to point your toes towards your nose. Now point them towards the ground. Now I'm going to do it against my resistance. Now point your toes towards your nose. Now point your toes towards the ground. Okay? And the muscle strength was +5 equal bilaterally. Now, make sure I didn't finish anything. Do you know what time I'm at?
12.
12 minutes? I had to miss a lot. Okay. Yes, I did. Now, I forgot to do the abdominal assessment. I'm going to go ahead and inspect the abdomen. Skin color is evenly pigmented. Contour is flat and symmetric. Umbilicus is inverted. And I'm going to go ahead and auscultate the bowel sounds in all 4 quadrants, starting in the right lower quadrant. And I would auscultate for a full minute in each quadrant. Okay, and normal bowel sounds were present. I didn't note any bruits during auscultation. Are you having any abdominal pain? Okay, so I'm gonna go ahead and start percussing in each quadrant. And did you note any pain or tenderness? There was general tympany over the abdomen. Now I'm going to start with light palpation. And did you have any pain or tenderness? I'm going to do deep palpation. Okay, I didn't note any masses or lumps during this. Now I'm going to ask you some questions about your bowels. When was your last bowel movement? Today. Okay, and have you had any constipation or diarrhea?
No.
And any changes in your stool?
No.
Okay, and what about problems with urination? Have you had any pain during urination?
No.
An increase of frequency?
No.
Okay, and what is your usual color for your urine?
Pale yellow?
Pale yellow. And have you had any unusual odor or color changes?
No.
Okay. No, I did. just gonna say I finished my assessment now. I'm gonna do my finish everything. So I'm gonna go ahead and lower the bed to the lowest position. And are you comfortable?
Yeah.
I'm gonna check the side rails and check the brakes. Brakes are locked. Here's your call light.
Mm-hmm.
Thank you for letting me perform this assessment on you. Is there anything I can do before I leave?
No.
Okay. Now I'm gonna do my S-bar. Okay, so 18-year-old patient came in complaining of shortness of breath and chest pain during activity. Upon my examination, I didn't find any abnormalities. There was no use of accessory muscles. Her pain was an 8 out of 10, and like we said, it was brought on by activity, and that was accompanied by shortness of breath. She doesn't seem to be in any distress at this moment, but I would recommend assessing her more, asking like a respiratory therapist to come in and check about the activity, the shortness of breath with that, and make sure that she is comfortable, and ask the doctor for any, I don't know. Okay, I'm done. Yeah.